both love. You're from Appalachian, Tennessee, and I appreciate your continued dedication to the region. I'm going to be in Appalachian, Virginia tomorrow visiting the Allegheny Highlands Dental Center, a dental center that serves folks in Appalachia that we were able to receive a significant congressionally directed expenditure to help them. But in particular, I want to thank you for your work on remote access medical. So just to paint the picture for my colleagues and those who are here, remote access medical does dental clinics and other medical clinics in remote areas. One of the first sites and continuous sites, annual sites for RAM is the Virginia-Kentucky Fairgrounds in Wise County, Virginia. And beginning when I was lieutenant governor, I will often go to volunteer on this 3-day weekend of service. And what happens is people start arriving about Tuesday or Wednesday to park their car in a dusty county fairgrounds parking lot to get a number so that when it opens Friday morning, they can go in and get medical care. The first time I came, I was struck when I walked through the parking lot. I would have expected to see vehicles from Virginia and Kentucky and Tennessee and West Virginia and North Carolina. But I was surprised to see vehicles with license plates from Georgia and Florida and Alabama and even Oklahoma, because people, low-income people at that point, beginning in 2002, 2003, had to drive that far to get medical care. The clinic offers all kinds of medical care, but by far the most significant usage of the clinic are folks who are seeking dental care. And the most significant thing is teeth extraction. If you just look at the bucket where the teeth are extracted at the end of each day, I mean, it's just staggering the number of people who have to drive state through state just to have that happen. The numbers of people going to the RAM clinic declined when Virginia embraced Medicaid expansion. That was positive, but because it's a border community and many of the surrounding states haven't done Medicaid expansion, there's still a lot of folks. But the numbers didn't decline on the people coming to seek dental care for a variety of reasons. Dental care not being part of the essential health benefits yet. And Virginia has embraced in 2022 a Medicaid expansion for dental care, and Virginia has also done a salary supplement under Medicaid for those who are serving, and yet still only 27% of our dentists accept Medicaid patients. So it's clear that we have an awful lot to do. Medicaid expansion has really helped the folks who came to that clinic and come every year, but on the dental side, we need more operations like the Allegheny Highlands Center that I'm going to tomorrow and others. And I just appreciate the role that RAM has played in this safety net. You know, it's kind of RAM is at the first rung of the safety net, and then free clinics and community health centers. And but in the nation that's probably the most powerful and wealthiest nation on the world, the fact that you'd have to drive through 3 or 4 states and park in a dusty parking lot and wait 3 days to get in line so you can have your teeth pulled. I mean, I was a missionary in Honduras when it was one of the poorest countries in the Western Hemisphere next to Haiti. You know, this was in 1980 and 81, and it's not that different from what you might see in the dusty parking lot in Wise County, Virginia, which is the area of the state that my wife is from. You said something, Dr. Simon, I wanted to follow up with you on, which is it's not just reimbursement, there's a cultural thing. Because you're right, if Virginia, we embraced Medicaid for dental services, we expanded it, and then the legislature put more money into increased reimbursement rates, and that's showing some success, but we still only have 27% of our dentists that accept Medicaid patients. You know, how do you view this cultural shift, any of you, and what might we do in addition to reimbursement increases to try to change that? I like who said if we can just get each, dentist to take 5 Medicaid patients, right? And then that plus the safety net would help, but what can we do?
I'd also point out that the 27% number doesn't even paint the whole picture, because only 5% of Virginia dentists see more than 100 Medicaid patients a year. Yeah. So you have an extraordinarily small workforce who's really doing the work. 100 Medicaid patients is not very many when the average dentist has a patient panel of 1,500 plus patients. So really, it's an incredibly small group. So I think understanding from that group themselves how they're able to do that. I would imagine many of them work in community health centers or other settings where they have sort of more infrastructural support in order to provide this amazing care. But understanding the dentists who are able to do it is probably the first thing. The other thing, more big picture, would be to make a shift between fee-for-service to a value-based care model. Right now, dentists feel like they're not getting enough money for each procedure they do. but patients would benefit if they didn't need any procedures, and dentists make nothing if that's the case. So a model that aligns patient and provider perspectives and lets dentists actually practice in a way that's more meaningful and preventive focused, I think is also a
Other
really important part
nations
of
do
this.
that, and they have much better health outcomes than we do. Any others that might want to comment on this issue about the culture shift, if my chair would enable me now that I'm over time to hear the answer?
Part of the cultural shift is to shift more towards prevention. But to be able to teach people how to prevent disease and how disease are interacting with one another really requires increasing health IQ, and it means that you have to do it in a culturally sensitive way, even in Appalachia. That's a culture, and you have to be able to use that as a way to be able to educate people about prevention. If we don't do that, we're never going to be able to fix and put Band-Aids on all these situations.
Dr. Minard-Jordan.
I certainly would agree with everything that's been said. The focus on prevention and increasing and leveraging the use of ancillary providers within dental practices so that the dentist is focused on working at the top of their licensure and aided by ancillary providers in the office that helps provide more access to Medicaid patients.
And then Dr. Isbell.
Yeah, I think it comes down to education, Senator. I think it's about treating every patient that we can. I mean, there's, in a practice like he's had and I have, there's only so many patients you can see. One of my associates treats the patients in the jail. Who wants to go do that? I mean, if you were a dentist, you're not going to want to do that. But guess what? They deserve care. How about our nursing home patients? We treat numerous nursing homes. We bring them in stretchers into our office to take care of them. And many of our elder care, they're coming in wheelchairs, but having the structure where it can be there. So it gets down to how much you do. Our children, we see so many of our children. We go into the grammar schools and teach oral health literacy to our children, and then we send brochures home to try to get to the parents. How do you get to the parents? Because guess what? They weren't raised with that, Senator, and the parents don't understand. So it starts from the bottom level, teaching the child, teaching the parent, and every access that we can to give them an opportunity to understand what Dr. Swan has said. If there's so many things that we do in dentistry that by education and getting on there with just simple prevention, we can save so much for every family and prevent the catastrophic stories that we're all telling.
Well, I appreciate your service, your testimony, and thanks, Mr. Chair. I yield back.